So should I start?
Hi, madam. Welcome to iMumz Ask Me Anything session. Hi, hello, good evening, everyone. We are back with another Ask Me Anything session with a very senior doctor today. And today is the 90th episode of iMumz Ask Me Anything session. And we have Dr. Madhu Rajpal ji with us. Dr. Madhu Rajpal ji is a very senior obstetrician and gynecologist practicing in city of Taj, Agra, Uttar Pradesh. She has been the recipient of National Gynae Colonist Award, and she is the recipient of UP government for Janani YOJANA. And today she'll be speaking about 5 tips to take care for the self-care in pregnancy. And after that, she'll be taking all your questions. So please post your questions in the comment section, and Dr. Madhuji will take them soon. Over to you, doctor. Please enlighten us. Please give us some valuable tips how to take care in the pregnancy, and then we'll start taking questions.
Good evening, friends. I'm going to talk about pregnancy. As we all know, motherhood is a bliss. If God has given you chance to become a mother, that means you are a great service to the society and to the world as a whole. So this is very important phase of your life. So that's the time actually you are rearing a living thing inside your body. So you should not take it lightly, but you should not worry about the things also. So once you feel that you are pregnant, definitely certain changes will start taking place in your body. What are those changes? The changes are that you start feeling some, in the beginning, some nausea, some vomiting, and some funny sensations, sometimes little dizziness, and even sometimes the fainting attack can be there. So what you have to do, you have to take care of yourself in those days. In the early period, when some nausea and vomiting are there, then you have to take some food every 2 hourly, because once you take the food, the acid inside your stomach will start working, and you will stop having this feeling of nausea. Plus, the signal goes to the brain that something has reached inside. So taking too early little milk is all right. Now, uh, please don't disturb Vijay. So every 2 hours you can take some meal, and once you're taking too early something or the other, then it is helping you to satisfy your desire, and plus acidity is less. Then the other thing is that any chemical, any food which contains something which you don't know, like preserved food or maybe the food, the market food and all, you should avoid taking that. All natural foods are good. Lot of green vegetable, lot of fruits, milk, and homemade nice food is very good. So you can start taking that. And but you should not consume lot of hot foods like lot of chilies and things like that. And even tea and coffee should be avoided. Coffee is definitely not good because it is a stimulant, and it will stimulate the baby also. So it's not a good idea to consume too much coffee. Then any medicine which is not given by a doctor or a gynecologist, the one who knows about the things, you should avoid taking those medicines. So this is in the first 3 months of life, and then definitely you have to go to a doctor regularly. Then after 3 months, every once in a month you have to go to the doctor, and doctor will advise you about your diet, about your rest, about the medications, and how to look after yourself. So even you should not think that once you are pregnant, that means you are supposed to take rest the whole day. This is the time only 10 to 12 hours of rest is more than enough, unless your doctor has said to said to tell you to take bed rest. So after 10 to 12 hours of rest, you can do light activity, but definitely you should not lift a heavy weight or please. You should not lift a heavy weight, and you should not try to fall or do something. Some dangerous activity should be avoided, like having any accident, or you are rushing to do the things. You should do everything very gently and look after yourself very nicely. Then comes that when to go to the doctor. Initially in the first 12 weeks, you should go to the doctor to confirm the pregnancy and what to do, what to not to do. And nowadays, around 11 to 12 weeks of pregnancy, we call our patients to do one ultrasound just to rule out some congenital abnormalities. And then we tell them to come back after 1 month, around 16 weeks or so, to rule out all the other anomalies. This is very important because suppose if there is some anomaly is there, this time we can take some action and we can help them. Then later on, regularly, as your doctor is calling, you should go. Mostly once in a month, we call our patients, and then after 30 weeks, we call them after every 15 days. And around term, like after 38 weeks, we call them every week. So approximately 8 visits are required throughout your pregnancy. So, as I've told you, diet you can take natural diet unless told by a doctor. You don't need bed rest unless told by doctor. Every visit, doctor will examine you. She will take your blood pressure. She will take your weight. She will take how much is the height of the fundus, whether fetal heart is available or not, and if required, she will do the ultrasound. Most of the time, we do around first at 12 weeks, then at 16 weeks, and then at 28 weeks, and then at 36 weeks, or if required, just during delivery also we do our ultrasound. So like this, doctor will be examining you. You should prepare all your list of questions, and whenever you go to the doctor, please, whatever questions are in your mind, ask her. She will answer all your questions and she will try to solve all your problems. During delivery, you should make sure which place you want to deliver yourself. So you should go and visit that place. You should see the room. You should see the facilities, and whether they have got proper labor room, proper operation theater, and maybe a neonatology unit is there. If all the facilities are there, you can choose that place and you can stay there. During delivery, most of the time nowadays, we allow one person to be there with you. Sometime the husband can stay, or sometime a lady can be there. So at we mostly at 9 months we tell the patient what is delivery, how labor pain will start, what will happen, and when you have to report to the doctor. So you can go at that time, and we look after you, and we see what is happening. We try to show the baby as soon as baby is delivered. Most of the time we put them to the breast so that when baby is sucking, then placenta is separated and baby cannot come out easily. So these are the things. Most of the time doctor will put up the drip, so don't worry about it, but that's for your convenience and for the doctor to give any injection or anything at that time. So these are the things you have to look after, and please look after yourself. Or any question you are having, you can ask me. So it's like that.
Thank you so much for the set of wonderful advices, doctor. We have many questions. First question of the day. Indu Indraja, she is 37 weeks pregnant, and in the early stage of her pregnancy, the hemoglobin level is 13.9, but current levels are 10.8. Is it okay? Please suggest how can she improve the hemoglobin levels?
Okay, so your hemoglobin was 13 gram before, and now it has reduced. Actually, what happened? 10.8. So actually, what happened that during pregnancy, the fluid in the body increases, and red blood cell do not increase that much. So we call it hemodilution of pregnancy. Means the blood gets little diluted, and this time the requirement increases because you have to feed the baby also. The blood supply goes to the baby, so that's why whole 9 month we tell them to take iron and calcium and maybe some protein preparation they are taking, and if required we give them something to support the baby. So maybe you have not taken your iron properly, so that's why hemoglobin is 10.8. Although in India as a standard we take more than 10 is all right, but definitely I would have preferred if it was 12 or 13. But don't worry, you are at 37 weeks, 10.8 is also good enough. And if your pregnancy is normal, nothing much is there, you can be all right. If it would have been less than 10, we would have advised you intravenous iron. Your doctor can give you, if she want to give you one dose of injection of iron, you can take that. Or otherwise 10.8 according to government standard in India, it is quite all right. No problem, nothing to worry. It has gone down because of hemodilution, and maybe you were not able to digest your iron tablet properly.
Thank you, doctor. All the best, Indu. Next question by Shailaja. She's 37 weeks pregnant. Her GTT and blood pressure are normal in the recent scan. Cephalic presentation anterior upper grade 3 with the AFI 19 to 20. But a single loop of cord around the fetal neck. Is it okay for normal delivery?
Yes, single cord round neck is not much problem, because what happened when baby comes down, when head is delivered, most of the time, even if cord is there, we just with the finger we bring it down and clamp it and cut it. So there's nothing to worry. But if it is double cord round neck or 3 times cord is wrapped around neck, then it becomes difficult. In those cases we do cesarean section, because once the baby comes down, the second one presses the neck, so baby can have difficulty in delivery. But you have got only single cord round neck, that means it should not be a problem. Cephalic presentation means good presentation, no problem. Placenta is grade 3 at the upper segment, so nothing to worry. And if your bone size is all right, doctor says that you can deliver normally, no problem, then you go ahead with normal delivery, nothing to worry.
Thank you, doctor. All the best, Shailaja. Next question by Christy. She's 13 weeks pregnant. In her scan, she's having placenta previa. Is there any issue? What precautions should she be taking?
Many a times early in the pregnancy, like 13 weeks or so, we see that placenta previa is there, means placenta is situated at the lower level. And when the uterus grows, the placenta also goes up. And many times it happens that at full term, placenta is in the upper segment. This is known as migration of placenta. It doesn't mean actually that placenta is moving. It's like this, that the uterus is getting bigger and bigger, and placenta is not that much. It is occupying only 1/3 of the placental site. So it goes up and it goes away from the internal os. So don't worry at the moment, means during delivery it can go up, but we have to see at that time after 36 weeks. If it is still down, then we take some other action. But at this moment, nothing to worry, it will go up. Just believe that. But what precautions to be taken at this time? That you should avoid intercourse, you should avoid any injury to that part, or maybe lifting heavy weight or things like that. And not too much running around should be done, because sometime you can have bleeding because of the placenta previa. So please take care, and once it goes up, you don't have to worry. Only if after 36 weeks placenta is still down, then at that time doctor can take decision to deliver by cesarean section. But for that you don't have to worry now. It will be at term. If placenta is down, then only doctor does cesarean section. 13 weeks, many a times we see placenta previa, but we don't even mention to the patient. We just say that take precaution. And definitely intercourse should be avoided, because that can cause bleeding sometime.
Thank you so much, doctor. Next question by Vanita. Apart from iron and calcium, are there any other supplements to be taken in the 23rd week of pregnancy? She don't have any specific deficiency, but many times her food is not having all the nutrients.
Yes, definitely. Iron and calcium should be taken very regularly in our Indian diet, because most of us are vegetarian, so we are not taking enough protein. So even protein preparation, if doctor is prescribing, you can take that. And I think that's all. And take good food. In good food means lot of green vegetables should be taken, a lot of fruits. We mostly recommend that at least 4 fruits should be kept for a day, for a pregnant lady. So whole day, at least she should consume 4 fruits. That can be one banana, one apple, one mango, one something. Whatever natural fruit is there, you can consume that, and take from 1 to 1.5 liter of milk every day. So that means 1 glass of milk in the morning, 1 glass in the evening, or maybe you can take some curd or some preparation made of milk. So that will fulfill your calcium and milk protein requirement. If you're taking non-veg, you can take non-veg daily, no problem, nothing to worry.
Thank you so much, Doctor. Dr. Jaideep ji is welcoming you to this live session. She mentioned, welcome, dear Dr. Madhu. Welcome to the world of holistic approach to pregnancy. Thank you so much, Dr. Jaideep ji.
Yeah. Thank you,
Next,
Jadev.
next question we have from Shravanti. She's in 26th week of pregnancy. Yesterday night, she felt a sharp pain near the vaginal area. Is this pain normal?
Sometimes when head is striking the vaginal area, you feel little tenderness, little pain there. And but if the pain is continuing, she has to go and see the doctor. Mostly what happens, the labor pain is like that you'll feel the contraction all over the abdomen, means abdomen becomes hard and rigid consistency, then it goes away, then it comes back again. So if you feel that every 10 minutes you are feeling 1 or 2 or 3 pains, that means you have to go to the doctor. And whenever the labor pain is starting, most of the time you will have contraction like this. Plus, you might have some mucoid vaginal discharge mixed with little blood. That means that is known as show. That means the labor pain has started. Sometimes membrane get ruptured, and then you have a gush of fluid coming out. So these are the signs that you have to go to the hospital. One single sharp pain which goes away, and now if you don't have anything else, don't worry. I think take rest, and when the pain will increase, then you can go. Or whenever your visit is due, please contact your doctor.
Thank you, Doctor. Next question by Jasmine. When she started a pregnancy, it's 13.5 is her HB level, and in the 22nd week, it is 11.2. She's taking all the iron multivitamin supplements. How can she keep the HB maintained? This is her first question. Second question, her TSH levels are 3.6 and she's on thyroxine 0.25. Is that okay?
Okay, as already I have answered the first question, because of hemodilution of pregnancy, in spite of you taking the iron tablet, sometimes the hemoglobin goes down. Please continue taking your iron tablet, calcium tablet, and some protein preparation, and consume lot of green vegetables and fruits and milk, and you will maintain your hemoglobin with that only. So don't worry about that, and just keep on taking your iron tablet. So that is the one issue. The second issue was, what was that? Oh, thyroid. Thyroid TSH was 3 point something. Yes. So you have to get your thyroid test done every 6 weeks. So if it is increasing, if it is going more than 4 or something, your doctor will increase the dose. And sometimes it happens that during pregnancy, the dose is increased. So regular checkup is very important. We do initially in first 3 months, then every 6 weeks we keep on checking whether the requirement is increasing or not. Mostly we try to maintain between 2 to 4. Most of the time 2.5 is a good this thing, but if next visit it is coming higher, you have to increase your dose. So you have to maintain around 2.5, or less than 3 is better. So that is
Thank you, Doctor. Rashmi has a question. What are the chances of having healthy pregnancy after 2 miscarriages at 6th week? She don't have blood pressure, sugar, TSH, everything is normal. How many months she need to give gap after the miscarriage?
No, I didn't get your question.
Okay.
What are the chances of having healthy pregnancies after 2
2
miscarriages of 6
miscarriages,
weeks and
yeah.
don't have BP, sugar, TSH, all
Right.
normal? How many months? Actually, there is no need to give any gap as such. But what happened that most of the time, if you have got 2 miscarriages, we want to find out the cause. So we do certain list of investigations. Doctor must have advised you that contains CBC, group RH, VDRL, blood sugar, HIV, HbS, and one anti-cardiolipin antibody we are doing, thyroid test we are doing. So if something comes positive, we try to treat that. And apart from that, after abortion, we prescribe them folic acid to take before getting pregnant. So at least 3 months of the folic acid should be gone inside. But by chance, if you conceive in between, nothing to worry. You start going to the doctor as soon as possible. As soon as you know that you are pregnant, you should go to the doctor. Doctor will give you some medicine, and in these cases, sometimes rest is allowed, and plus some pregnancy maintaining medicines are given. And then when cardiac activity comes, then some injection doctor will prescribe, and after 3 months, doctor will examine and see that whether your cervix is competent or not. If cervix is not competent, then sometime they apply a stitch there, and so that you can maintain the pregnancy. And then full 9 months, doctor has to look after you. But most of the time, when ladies having abortion at 6 weeks, 2 abortion at 6 weeks, she doesn't need those stitches and all. That is mostly when after 3 months they are getting the abortions, then only they need that stitch. So don't worry, you can conceive, but take folic acid beforehand only, start it, and stay natural. Whenever you get pregnant, go to the doctor. And make sure your list of investigation should have been completed. The doctor, whatever she has prescribed, as I've told you, the test she will prescribe. So you have to get those tests done. And then once everything is all right, you can ask your doctor, can I go ahead with the pregnancy? She can tell you yes, and then stay natural. Maybe 2 to 3 months will pass, and then you get pregnant. So then it's okay. Nothing is such that for 6 months you don't have to get pregnant. It's not like that. But start taking folic acid, and if 3 months of tablet has gone inside, it's more than enough. And during pregnancy also we prescribe them folic acid, so it's okay.
Yeah. Thank you so much for that assuring advice, doctor. We wish you all the best, Rashmi. Sonal has a question. She is in 30th week of pregnancy and she is feeling difficulty while breathing in the night.
While breathing at night. Yeah, most of the time it happens. A pregnant lady, when she is lying down flat on the bed, she feels difficulty in breathing. So that's not a very good position. If you can sleep on left lateral position, means turning on the left side, and if you're feeling difficulty in breathing while lying down flat, you can take one or two pillows with you. Or if suppose you are suffering with some problem, maybe if you're asthmatic or some breathing problem is there, then you have to go and see the physician. So he will examine your chest and tell you what is the problem. And but normal breathing problem comes flat in the bed only. So please don't lie flat. You can just take one or two pillow and lie on your side. That is more important. And then if the problem is more, you have to get the problem the doctor.
Hello, can you hear, doctor? Hello, doctor.
Yes.
Okay. Next question we have from Tripura. Actually, Sonal has mentioned that she is not asthmatic. She's not asthmatic.
Sonal has asked.
Yeah. Sonal, who is having problem in breathing.
She's not.
She doesn't have any asthma and all.
Fine. So most of the time, is lying down is the problem. Lying flat on the bed is the problem. So mostly, that's the problem. And little bit minor difficulty can be there because if you're anemic, so doctor should check your hemoglobin also. That if you're not anemic, ask your doctor when you are going there that this is the problem. So whenever you're going for antenatal checkup, ask her that I'm having difficulty in breathing, so she can check you up.
Thank you, doctor. All the best.
But most of the time, the normal reason is that lying flat on bed is, supine position. Means straight if you're lying on bed, you will feel difficulty in breathing.
Thanks, doctor. For those who are missing the weekly webinars, we have a very interesting webinar every Sunday. So all these Sunday webinars and more new exercises like meditations, music and all are a part of baby care program. So you're missing out. So please subscribe to the baby care program and get all information, get all exercises which are useful in this beautiful phase of your pregnancy. So I suggest you to check the baby care program inside the app and check the benefits. Please feel free to contact our
About
team
the
in case
exercise,
if you
I
have
can
any
add
doubts.
something.
The next question we take from
What I was saying that about the exercise, I can add that any exercise you are doing during pregnancy, it should not affect your back. Means you should not do toe touching or things like that. Stretching exercises are all very good for you. Breathing exercises are all very good for you. All relaxation exercises are very good. But when you have got big tummy, the exercises which are pressing your tummy, they are not very good. So you have to look after all these things. You have to look after your back, you have to look after your posture, and you have to see that you are not pressing the abdomen very tightly. So rest of the all exercises you can do. You can do yoga where leaving apart the toe touching and things like that. So all stretching exercises are good, and all breathing exercises are very good, and even walking is the best exercise. You should continue doing that. And whatever they're teaching you with the music, that's lovely. You should definitely join because they are created by the expert. So it is good to do all those exercises.
Thank you, doctor. Tripura's question, she's in 19th week of pregnancy. She have low-lying placenta. What precautions should she take? Can she use Indian toilet? This is her first pregnancy and she is 31 years old.
Okay, and how many weeks of pregnancy?
19th week of pregnancy.
Anyway,
One
as
night.
I've told you, if placenta is down, we have to take precautions, because what can happen in placenta previa, in low-lying placenta, sometime causeless, painless, and without any reason, bleeding can take place. So we have to take care that if sometime bleeding is taking place, we have to take rest. We have to go to the doctor. We don't have to panic. And maybe if you are not full term, she will give you bed rest, and she will give you some uterine relaxing medicines, and you're relaxing for your brain, and then you become all right. So the precaution at home should be that you are not doing heavy work, like you're not lifting weight, you're not running around too much, and but if bleeding has to take place, even if you're lying down, sometime bleeding can take place. So you cannot avoid that. That's why we call it causeless and painless bleeding is there. Um, they do say that avoid intercourse because placenta is low lying, and so that's the only thing you're going to do, and not do heavy work. That's all. And don't worry about it if it is low lying, and if you're not full term, maybe, as I've told you, it can go up, so you don't need anything. But if you're full term and it is placenta previa lying low, enough low, so doctor might prescribe you cesarean section. So don't avoid that. Tell them that yes, I'm okay with it.
Thank you, doctor. Vanchika has a question. She's having PCOD and the left tube is blocked and she's also having problem during the intercourse. So she's asking for a suggestion.
So she's not pregnant, is having
Uh,
PCOD,
yeah,
left
doctor.
tube blocked, and having problem due to sex. Okay, is she pregnant or she's not pregnant?
I think she is not, Dr. Kavit. Vanshika, can you mention if
Anyway,
clearly your
we can
problem?
talk about PCOD. PCOD is a condition in which in the ovary, lot of cyst-like structure is there, and the top layer of the ovary is thick enough. So ovulation is not taking place properly. So that's the condition where you are having difficulty in conceiving. And you've got another factor like one tube is also blocked, so you can have difficulty in conceiving. If you have already conceived, then also you have to look after yourself and take the medicines prescribed by the doctor, because all PCOD patients will have chances of abortion little more than other ladies. So you have to take precaution with that also. And full 9 months you have to look after yourself. And as the doctor says, you can have normal pregnancy and you can deliver normally. There's nothing to worry about that.
Thank you, doctor. Next question we have from, one second. Yeah, Ananya has a question. She's 37 days pregnant, 37 weeks pregnant. The baby's position is cephalic. To drop baby in pelvis, currently she's doing squats and walking. When can the baby drop, and if she feel pain in the pelvis, shall she stop these exercises?
Okay. Actually, let me tell you, this is a normal procedure. If your pelvis size is all right, baby itself will enter the pelvis at after 36 weeks slowly, and it will go inside. And sometime the completion takes place during labor also. In the early labor, because of the contraction, because of the pain, baby is pushed down and baby takes its position. So it is the duty of the doctor to see. But definitely, if 37 weeks it's high enough and it's your first pregnancy, so sometimes we doubt that maybe pelvis is not adequate. So we try to examine the pelvis in comparison to the head of the baby, and we try to see what is there. Sometimes we ourselves push little bit the head and head goes down. So we take the sign that okay, it will go down with the pain. Sometime multigravida means the one who are having third or fourth children, head is not engaged, head has not gone in the pelvis. So nothing to worry. We don't worry about it. When the labor starts, it goes on its own and they deliver normally. But if we feel that head is not going down in the first pregnancy and we feel that her pelvis is small in size and baby's head is bigger, then that is the reason. We can know what is the reason. Like there is no cephalopelvic disproportion is there, means head is bigger and the bone is small. So in that case, we take decision that how we have to deliver the baby. Sometime if it is too short, then we have to do cesarean section. If we feel that she can deliver normally, we give trial of labor and we try to deliver them. So that's the thing. Nothing to worry about that. And yes, if lot of fluid is there inside, doctor is saying too much fluid is there and baby is not getting engaged, then sometime it can be a problem. In those cases also, during labor, what we do, we push the head down and we do the rupture of membrane. We rupture the membrane and head comes down. So don't worry, this is the duty of a doctor. You don't have to worry about this thing that head is not engaged, and you cannot do anything about it. Yes, if you're doing your exercises like squatting exercises or you're walking, so head takes the signal that I have to go down. So it comes by its own. So it is a natural procedure. Actually, you cannot do something about it. Keep on doing your regular exercises. You can keep on walking. You can do little squatting exercises. You can do all these things, but don't worry about it. Let the doctor decide what she has to do.
Thank you, doctor. Suvarna has a question. She have OS teaching, and she is in the 36th week of pregnancy now, with the due date 30th July. Doctor has given her 18th July date for cesarean. Can she wait further? She is
Due date is
scared
18th
about
July
yeah, she's scared about the labor plans and labor
for
pains
cesarean section.
right, and when they will start and will there be an emergency? She's scared of it.
No, I didn't get you, doctor. I have stitching and I am at 36 weeks of pregnancy now. My due is 30th July. Okay, that means you had cesarean section beforehand only, isn't it? So stitching means you had cesarean section before. If you are a case of previous cesarean section, then doctor decide at 38 weeks what she is going to do. Whether she is going to give you a trial to deliver normal or she want to deliver you by cesarean section. If suppose in first pregnancy the cause was cephalopelvic disproportion, means your bones were small, and now you have got one cesarean section, she want to operate you again, it's okay. I think she's right in doing that. Or if suppose head is not there and some other malposition is there, she want to decide for cesarean section, let her go ahead. And if your everything is all right, like pelvis is all right, everything is okay, and you had first cesarean and she want to try for normal, you can go ahead with that only. So I think nothing to worry about that. So why you are scared about pain? Is she going to do the trial of labor?
I think she's generally concerned about the emergency doctor. So she is asking you for a suggestion there. Okay, next question we take from Kavita Sharma. She is in 16th week of pregnancy and she is facing severe headache so many times from the starting of the 4th month. Please guide because she is not taking any medication for the headache.
Okay. Kavita Sharma is asking about the headache. Can I answer? Yeah, Kavita, actually, we have to see what is the cause of the headache. Sometime, if you are suffering with migraine or some pain in some headache beforehand only, so that can increase during pregnancy. But if it is a new pain, you were never having any pain, any headache before. So I think you should go and see the physician, get your blood pressure checked up, and get your eyesight checked up. That whether you need any spectacles or not, or then after that the physician will decide what is the cause of the headache. You should not take painkillers yourself. Maximum, if really required sometime in emergency, you can take simple paracetamol. So I feel that is more than enough, but definitely we have to find out the cause of the headache. So it's a pregnancy is never a cause of headache. Yes, if you are suffering with migraine or something like that, that increases sometimes, so you may need to have a dose from the doctor only, and that's all. Nothing to worry.
Thank you so much, doctor. Next question by Kanika Sharma. She is in 36th week of pregnancy and she went for color Doppler test today. And the baby's parameters are as they should be in the 38 to 39 weeks of pregnancy. So, is it something to be concerned about?
Yes, maybe the doctor will do the color Doppler after 1 or 2 weeks more, and see that she's not suffering with insufficiency, and some such changes are not taking place which can kill the fetus within few days. So doctor mostly tells by seeing the pattern. You know, the umbilical vessel, they do color Doppler and they see what is the ratio between systolic and diastolic, and they try to tell them that baby is in danger. If baby is in danger, we have to deliver the baby. If baby is still not in danger, and it is only the 1 or 2 week difference is there, so don't worry. After 2 weeks, you can go to the doctor again, and maybe she will repeat the color Doppler and see. And in between, if you develop your pain, that's okay, there's nothing to worry. If doctor has said no insufficiency is there and pattern is totally normal, don't worry about it. But if she says that there are changes, especially in the cerebral vessel, in the vessels in the brain, that means baby has to be delivered fast. So if doctor says it is dangerous, then only think it is dangerous. If it is 1 or 2 weeks ahead, don't worry about that. But go to the doctor after 1 or 2 weeks again.
Thank you so much, doctor. Next question we take from Shirisha. She's asking at what time the TIFA scanning should be done.
First scanning, yeah. First scanning means whenever the patient comes first to us, we do one scanning just to see what is the size of the baby, what will be the expected date, and to confirm the dates that whatever she is telling it is correct, and baby is
Sorry
in
to
normal
interrupt,
position.
doctor. So sorry to interrupt. She's asking about TIFA scan. TIFFA, TIFA scan.
Which scan?
TIFA, TIFFA, TIFA scan.
I don't know about it. Why does she want to get it done? Or maybe the full form she can tell me.
Yeah, 1 second now.
Is mostly it happens that around 12 weeks we do to see the nuchal translucency, And around 16 weeks, we do for the congenital anomaly scan. And if we find some problem is there, then we do some blood tests to find out whether abnormality is there or not. Like, maybe alpha fetoprotein or things like that, or estriol level. So maybe the short form she's saying is for alpha fetoprotein, I think she wants to know.
I think it is anomaly scan, I guess, doctor. It is the targeted imaging for fetal anomalies.
Oh, that's
Maybe.
okay. Fetal anomaly, as I have said, it
Yeah.
is the full fetal anomalies can be do between 16 to 18 weeks. And but at 12 weeks, 11 to 12 weeks, we do one for the nuchal scanning and one for the nasal bridge. We try to see the nasal bone and the nuchal scanning. That rules out Down syndrome. And but full scanning, seeing every part of the body, that we do between 16 to 18 weeks. So most of the time we are calling them at that time and trying to do the congenital scan at that time. So full scanning we do at that time. So I think she can go to the expert where level 3 scanning can be done, and it should be definitely done.
Thank you, doctor. Shailaja would like to know one thing. She's planning to conceive, but the gynecologist told her to have prolactin test, and the result came out as 20. But the gynecologist saying it's more. So what can she do to the next steps?
Okay. Actually, whenever you're trying to get pregnant and you're not getting pregnant, then we do hormonal assay, in which we do follicle stimulating hormone, luteinizing hormone, prolactin level, and thyroid level. If prolactin level is high, then most of the time lady is not able to conceive, but there are medicine available for that, and we give them to control the prolactin level. And she should take with the help of the doctor only. It is capgulate, but doses are adjusted according to the prolactin level, and once in a week tablet is given. And most of the time, if you correct that, they conceive. But then we have to see if some other abnormality is not there. And plus we have to see the status of the tube, we have to see the seminogram, means husband's semen is quite all right. And if everything else is all right, only prolactin is a problem, doctor will prescribe the tablet, and she might conceive. And sometime if they don't conceive with that, doctor gives ovulation inducing medicines, and patient she will conceive. She doesn't have to worry about that. If she's going to an infertility specialist, she will definitely give her some medicine for that, and she will conceive. So don't worry about that. If doctor has done the test, it's good she has done and found out what is the reason.
Thank you, doctor. Nivedita has a question. She's 24 weeks pregnant. Currently, she's having heavy pelvic pain, mainly near the vaginal area. She's not able to move. What can she do for it?
Okay. At 24 weeks, it is abnormal to have too much pain in the vaginal area. Because full term, I can understand the head is pressing, so she is having pain. So at 24 weeks, we have to see what is the cause. And sometime the cervix uterus is shifted down. So you feel lot of pain in the vaginal area. So doctor has to examine and see if this is the reason. Then most of the time we tell them to raise the foot end of the bed, and she's taking rest. We give some medicine to relax the uterus, and some tablet to maintain the pregnancy, so that she does not abort or she does not go into premature labor. So definitely if too much pain is there, she has to tell her doctor, the doctor, I'm having too much pain, what is the reason. She may examine her vaginally and see the uterus is not shifted down or something like that. So definitely this has to be shown to the doctor. Little bit pain, I understand, it's a normal thing, but too much pain means going to the doctor is important, not taking painkiller yourself.
Shravanti is in the 26th week of pregnancy, and because of full itching, she did the LFT test, and protein is 6.5, albumin levels at 3.4, and bilirubin direct levels at 0.5.
Alkaline phosphate is 158. Okay, is there any problem? Mhm. Actually, what happened, if too much itching is there, most of the time the problem is that because after all baby is also a foreign body, So sometime allergic reaction is there and you get this thing. But most of the time we do liver function test, and as alkaline phosphatase is raised, and sometime when we do ultrasound, we see stasis of bile in the gallbladder. So that is the cause. So we have got some medicine for that, and we prescribe for 10 days or something like that, and patient feels better. Otherwise, if there is nothing wrong, then we give them simple anti-allergic tablets, half tablet, if especially at night they require, because itching is too much and that is disturbing at night. And maybe some moisturizer can be applied on the skin wherever it is there. She should not scratch herself, because a lot of marks will be there after delivery. So it's better that she asks her doctor, because in her case alkaline phosphatase is increased. So maybe doctor will prescribe medicine for 10 days. Medicine come by the name of Udiliv or something like that. So no problem, nothing to worry. This is a normal condition in pregnancy. Many ladies will get that. So don't worry. And sometime it is repeating itself, like in first pregnancy I've got, in second also she'll say that I'll get itching during all my this thing. So some lactocalamine can be applied there. Soothing agent means itching is not there, and maybe the doctor can prescribe the tablet. She can take half tablet of that, or as much it is required. But if liver function is disturbed, then we give a course of medicine for 10 days. If she becomes all right, it's all right, or maybe we can repeat it sometime. So don't worry, doctor have got medicine for that, and it is a common condition. Only thing is that you have to take precaution. That's all.
Thank you, Doctor. Mansi has a question. She's in 28th week of pregnancy and she's feeling frequent urination in the past 1 month, and also
Pins in pelvis. Mm. Sometimes is it normal? Very good, doctor. Thank you very much. Talking 37-year-old. She's 28 weeks and frequent urination. Actually, frequent urination is a normal thing in pregnancy, because we understand that bladder and uterus are nearby. Bladder is in front, uterus is in between, and rectum is behind. So definitely, if something is growing inside the uterus, it is putting pressure on the bladder. So frequent urination is a normal condition. But if with that you get some difficulty in passing urine, or some pain during passing urine, or some burning sensation is there, that means so you might have some urine infection. A simple urine test, routine microscopy can be done. If there are a lot of pus cells, then doctor will prescribe you the medicine which is acting for the urinary tract infection. And at the moment I feel drink a lot of water and don't worry about it. Only get one urine test done. That's all. And if something comes out, then doctor will prescribe the medicine to you, and please take that medicine. That's all.
Thank you, Doctor. Next question by Subhashina Sahu. She's 12 weeks pregnant. The ND is 0.9 mm and the NB is 2.6 mm. Heartbeat rate is 162 and cervical length is 45 mm. Are the readings normal? When should she go for double mark?
And please repeat the question. I could not get it. Hello, what's the question? Hello.
Yeah. Can you hear, Doctor? Can you hear me now?
Please repeat the question. It is not showing
Yes,
on the
ma'am.
screen
Yeah,
also.
yeah.
What was the question?
I can't show this on the screen because it is asked inside the iMumz app. I'll read it for you. So,
Okay, just read
Subhashina
it.
Sahu, she's 12 weeks pregnant, and in the NT scan, the NT is 0.9 mm and the NB is 2.6 mm, and the heart rate is
Okay.
162, and the cervical length is 45. She's asking if everything is fine, and when can she go for double marker or triple marker test?
That's okay. Everything is fine at the moment. Nothing to worry about it. Double marker and triple marker, if doctor is advising, if she's more than, what is her age, by the way?
Age is not mentioned here. Gestation age is
Anyway,
12 weeks.
she can go for a second ultrasound scan and double marker and triple marker also after the second scan. She can go for it.
Thank you, Doctor. Akriti has a
Like
question.
after 16 weeks or so.
Right. Akriti's question is on the screen.
21 weeks of pregnancy, suffering from left rib pain throughout the day and gas problem. My hemoglobin level dropped to 9 recently, which was 11.5 at the onset of pregnancy. My BP is always low. Don't worry, blood pressure goes low during early pregnancy, so nothing to worry about that. Hemoglobin, as I've said, there is hemodilution, but definitely you have to take iron tablet regularly. If you're not taking iron tablet, doctor might have to give you intravenous or intramuscular iron. So please take your iron regularly. And the pain on left side of the rib can be because of low oxygenation. Hemoglobin is low. Most of the time it is muscular pain which is troubling you. And so please tell your doctor. She will prescribe you some medicine. And please take your iron tablet regularly. Take good diet, lot of green vegetable, fruits, milk. And one of the way is that they say that cook your food in the iron utensil. So sometimes some iron is coming from that. Even jaggery, gold is very good for that because they cook it in iron vessel. So take good food, means lot of green vegetable, fruits, milk, all the things nicely. And take your tablet regularly. It's not a good idea that my hemoglobin is dropping. And because of low hemoglobin also, you can have chest pain. So please take your medicines properly, and doctor will just check that what is the cause of the pain in the rib area. Most of the time it should not be the pain should not be there. It is muscular pain only, so doctor will prescribe you some little medicine for that. So don't worry about that, but look after yourself nicely.
Thank you so much, Doctor. Sorry, Sneha, we missed your question. I'm taking it now. Sneha is 16 week pregnant. Her legs started paining since first month, and they pain a lot. She do yoga under instructor and walk for 35 minutes every day. What could be the reason for the pain?
Most of the time pain in the legs is because of the lack of the oxidants. So you need lot of antioxidants you are needed. Lot of green vegetable and fruit should be taken. And even lack in calcium also causes leg pains, so calcium also has to be supplemented. And sometimes they say the potassium can be responsible. So our citrus fruit like orange or lemon, these things are good for that. But if you're doing too much work and too much yoga, too much stretching, maybe the pain can be because of that also. So please do the relaxing exercises more and breathing exercises more than walking too much and doing tough exercises. So that's important. So what I mean to say is that do more relaxation, take a lot of milk and calcium tablet regularly, take your iron tablet regularly, and citrus fruits you can take, and sometime doctor prescribe antioxidants, so which can increase this thing. But the natural fruit can also do all these things. Don't try to take painkillers and all unless it is really too much, or maybe some time, at 9 months or and all. We all have been mothers, so we understand lot of pain is there. So somebody can press your legs at that time. So, but don't do too much exercises and all. That can also be a cause of pain in legs.
Yeah. Thank you, Doctor. Chiranjeevi Siripurapu, she's in the 18th week of pregnancy also, she's having vomiting. So she's taking Ondam injection and it controls only for 3 days. Is it
No, too much anti-vomiting injections are not good. Once in a while, it is all right that you can take injection, but not every 3 days you can take. So most of the time, as I've said, you have to do the diet management, like take too early something or the other, and sometimes dry things like biscuit, rusk, things like that. Every 2 hours you take little bit, and it becomes all right. So don't take too much this thing. You can take tablet also, although tablet works little later, like you have to take regularly. So too much anti-vomiting drugs are not very good. Once in a while, it is all right. Most of the time, try to avoid staying empty stomach, and I think you should be all right. And even one or two vomiting in a pregnancy is not that harmful. They say mostly it is harmless, but if too much vomiting is there, like that is known as hyperemesis gravidarum, like every day you are vomiting 4 or 5 times and you're losing water and you're not able to drink anything, then only IV fluid has to be given. Otherwise, by diet management, taking little medicine will help. So please don't keep on taking injection every third day. That's not a good idea. And maintain your hydration. Keep on taking your diet properly, and you will see that you are all right. One or two vomiting in a day is not that harmful if you are eating properly and if you are maintaining your hydration properly. Don't worry. Don't take too many injections because that's not
Thank
very
you,
good.
doctor. Thank you so much. Tanvi has a question. What is the ideal time to conceive after the missed abortion? What are the chances that next pregnancy will be fine? How can she take care of herself? After miscarriage, what food can she do? Exercise and running. She's asking for suggestions.
Okay. This question was answered before also. We have to get our investigation done. Even if most of the time they used to say that 3 abortions and then you do. But nowadays, we even after one abortion also, we do all the tests to find out what was the cause of the abortion. And once we find that there is no cause, we prescribe them folic acid. We tell them you take normal, good food, taking lot of green vegetables, and all the other nice things you should be taking. And folic acid, we prescribe them. Keep on taking that till you conceive. Taking 3 months of folic acid, 90 days is more than enough, and ruling out that there is no problem. And once you conceive, as soon as you conceive, go to the doctor and tell her that you had missed abortion. Doctor will look after you. She will prescribe you folic acid. She will prescribe you the medicine which will help in sustaining the pregnancy, and I think you will be fine. Don't worry about that. 3 month gap is more than enough. But if you conceive little before, don't worry about that. So it's okay. But if you don't conceive even after 6 months and your age is increasing, you can go to the doctor to find out the cause, and she can help you.
Thank you so much, doctor. We wish you all the best, Tanvi. Missy has a question. She's 26 weeks pregnant. She's feeling so hot these days. Have to keep the AC on, or else she's sweating a lot. She's also having headaches nowadays, and she's worried if she's catching the cold. If What should I do if I catch the cold? She's asking. Also, she's prone to catch the cold easily since the childhood. She's inhaling, steaming, gargling, and but still sweating a lot, and also having headache.
Okay. Actually, this is pregnancy is a hormonal condition. Lot of hormones are there. So definitely, whatever we feel, the pregnant lady feel little more. It's really hot, especially in our northern area and things like that. So definitely, she must be feeling hot. And most of the time, it happens that we want to keep our AC on. So I think there is nothing wrong in it. Eh, You don't catch cold because of the AC. You catch cold because you are coming in contact with the person who is having cold or something like that, or you're allergic to something, then only you do. So if you're allergic to something, try to avoid using those things. Otherwise, stay in AC, stay in clean atmosphere, stay away from the person who is having infection, and don't worry about that. Headache, yes, we have to see whether her blood pressure is all right and nothing else is there, or she's not suffering with fever or something like that, or she's not having any eye problem, and things like that. So headache, we have to rule out what is the cause behind it. Otherwise, I think staying in a cool atmosphere is a good idea. Nothing bad in it. You will not develop cold because of the AC. You will get cold either because of the allergy or because of the infection, viral infection or something like that. So please look after yourself, that you keep the atmosphere clean, no dust, nothing, and you are in a AC. Please stay there, don't worry. We are all in AC nowadays, and definitely pregnant lady feels little more than what we feel normally. I think it's okay with you, nothing to worry.
Thank you
But
so much, doctor.
headache, whenever you are going to doctor, tell the doctor that doctor, I'm having headache. She will check your blood pressure. She will ask you to check your eyesight and things like that, and she will help you in that.
Thanks, doctor. One last question of the day, Reshma. She's having single intrauterine gestation corresponding to a gestational age of 13.4 weeks with marginal previa and retrolental bleed. Is it necessary to go for a double marker test?
Um, 13 weeks retroplacental clot is there. Yes, she has. So doctor must have advised her to take bed rest and all, and she can go for test. There's no harm in that. Marginal placenta, nothing to worry. It will move, so you don't have to worry about that. And how old is she? She has not written that. Anyway, but I think if she can go for anomaly scan and for testing, don't worry about it. Get it done. If your doctor wants you to get it done, please get it done.
Thank you so much for answering all the questions so patiently, doctor. We ran out of time actually. So sorry, I can't take any more questions for the day. So let's all thank Dr. Madhu Rajpal ji for giving us some wonderful suggestions on how to take care in general in pregnancy and answering all the questions. So we have pregnant women across the country, around 2,400 pregnant women across the country have joined us on YouTube and inside the iMumz app. Thank you so much, Dr. Madhuji, and thank you everyone. The questions which we missed, please post them in the iMumz feed section, and we definitely try our best to answer each and every question. And have a great weekend, everyone. Subscribe to the baby care program. Experts have designed meditations, music, talk to the baby exercises, and all for you, for your physical and mental well-being, and also for your baby. And also, baby care program enables you to join very good closed webinars. Where doctors can interact with you personally on a Zoom call on every Sunday. So it is still available at a very discounted price. So subscribe to the baby care program. Thank you so much, doctor. It was a pleasure hosting you and having you with iMumz.
Thank you. I really enjoyed myself. The program was very good, and I will say questions were very intelligent. They were nice questions, and I feel that I'm really happy if I have solved their problem in a real scientific way. That's very good, and definitely I love this program. And maybe I don't mind coming back again if the ladies are interested in asking questions.
Definitely, doctor. We would love to see you again. Thank you so much for joining.
Thank you. Thank you so much.
Have a great day, everyone. Bye bye, doctor. Thank you.